Hello, and welcome to today's webinar, an RX for Behavioral Health Equity, Digital Therapeutics. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on your PC, or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Drs. Robert Cuyler and Avrim Fishkind, along with Miranda Wilson and Solome Tibebu. Dr. Robert Cuyler is Chief Clinical Officer at Freespira and responsible for clinical training and supervision of Freespira's assessors and coaches, as well as a leader in the company's outcomes studies. An active practitioner, he also sees patients at his Houston practice. Dr. Fishkind serves as a medical director of psychiatry at Freespira and is a pioneer of emergency telepsychiatry and an inspiring visionary with the psychiatric community, where he works to advance the profession's future, including telemedicine and digital therapeutics. Miranda Wilson is Senior Director of Patient Engagement and Experience at Freespira, focusing on the needs of individuals and communities that may benefit from the company's breakthrough treatment for panic disorder and Ptsd. Before joining Freespira, Miranda led member engagement for a large health insurer provider. Solome Tibebu is a well-known industry and patient advocate, as well as the founder and host of Going Digital, Behavioral Health Tech. She collaborates with a wide range of organizations, including telehealth and mental health companies, health plans, and systems. At this time, I would like to turn the floor over to today's host and moderator, Solome. Welcome.
Excellent. Thanks so much. And thank you everyone for joining us. I'm super excited to moderate today's webinar, A Prescription for Behavioral Health Equity and Digital Therapeutics, and really the discussion on the role of digital therapeutics and how they play support and access to behavioral health care. So as mentioned, I'm a behavioral health strategist. I'm passionate about how frontier technologies and solutions are really transforming mental health and equity and access in general. So this all really led me to developing the largest conference now around virtual behavioral health tech called Going Digital Behavioral Health Tech Summit, coming up June 8th and 9th. So would love to see you there. But now, in the meantime, I'm super excited for our panel of experts today who are equally passionate about the promise and potential of digital therapeutic treatments, which are expanding and improving behavioral health options for a very wide range of people. Panelists, I know we did some introductions there, but I would love to hear from you each individually. If you could say your name, role, areas of interest, and really why the topic of access is important to you. So why don't we start with Dr. Fishkind, then Dr. Cuyler, and then Miranda Wilson, please.
I'm Dr. Avrim Fishkind. I'm an emergency and community psychiatrist. I've been practicing for about 25 years. I've been looking for ways to move beyond medications in practice, and so looking at the use of telepsychiatry, prescription digital therapeutics, and I guess still in meds, ketamine, transcranial magnetic stimulation, other alternatives to the more common psychiatric medication. Glad to be here today.
And I'm Dr. Bob Cuyler. I'm a clinical psychologist by background. Really, a lot of my career has been involved in one way or the other in improving access to care. About 20 years ago, a partner and I started a company bringing mental health services to rural community hospitals. And that's when I discovered technology and telemedicine. That was really the only way for many of our more rural locations that we could bring psychiatric services into these communities, really around the time that technology was advancing and broadband was actually becoming available. That morphed into my focus in digital therapeutics and my current role with Freespira.
And I'm Miranda Wilson. I am an engagement strategist leading patient engagement and experience at Freespira. I am very interested in equity in general, especially in the healthcare space, and the opportunities of products like ours to both demystify and create access for people across the healthcare system. And this just represents a really great opportunity to have the clinical advancement technology really meet people where they are in their healthcare journey, and very specific to the kind of care that they need.
Excellent. Thanks, everyone. So let's see. Let's start with Dr. Fishkind. You've been president of the American Association for Emergency Psychiatry. You're a pioneer in telepsychiatry, having founded one of the nation's first 24/7 telepsychiatry companies. You're now director of telepsychiatry at the country's largest community mental health center and a medical director at Freespira. Given your deep experience, particularly in community psychiatry, how has COVID affected behavioral health offerings and treatment?
Okay. So it's a good question. I think I probably don't need to use exact numbers, but some studies show 42 to 45% increase in our major mental health diagnoses during the time of COVID. So major depression, PTSD, panic disorder. And, this is brought on, I think all of us are working remotely. We're doing it right now. And I think we all can understand that it's the social social isolation, the increased unemployment, the massive loss of revenue, and also just people adjusting to working at home and being with their kids and the extra pressure and anxiety of juggling all those things at home. I look at a little more specifics. So this slide represents telehealth trends. And what I want you to note is that you'll see the whole chart is from August 2020 to February 2021. And you'll see that there's a dramatic increase in medical claims. This is to be expected. And you'll also notice around February of 2020, you'll see a decrease in all settings of care, but you'll see this massive spike in people that are of claims for telehealth services. In the next slide, I just want to emphasize to people that when you look in this you'll notice that behavioral care tops the list in terms of volumes. And I need you to keep that in mind as we go along, because it's very important to understand the breadth of this problem in the behavioral health care space. So I've also been interested in access and equity for a very long time. When I started my first telepsychiatry company, the whole purpose was to get to populations that could not be seen in any other way for mental health care. I want to stress that it's very important to understand that there are many disenfranchised populations that have not moved and adapted as well to using technology and telemedicine during COVID. Black populations, indigenous peoples, especially on reservations, people of color, and just in general rural populations have not had the kind of access to these technologies prior to COVID and during the time of COVID. And, we should understand that we have the ability to help all these people. We now can work across state lines. We have the ability to get paid for providing telehealth. We can use different types of clinicians across a different array of remote care. And at the same time, remember that this is easy to adopt for some populations and not for others. So we can talk about inequity for just a second. There are a lot of questions when you switch to technologies. How do you implement it? How is it implemented on the patient side and on the organizational side? Who's educating patients and consumers as to how to even use these technologies? My one that I've been concerned about the most is the cultural sensitivity of putting out different digital technologies. Each community may respond to the use of remote technology or technology that's used at home in a different way. And of course, a lot of the inequity is driven by the fact that people may not have computers, cell phones that can do telemed visits, or the broadband in order to be able to do remote visits. So my focus has been mostly on Latinx, African American, indigenous people on reservations. They're all at the highest risk for having the least amount of digital access. And I'll just point out that one thing that we're going to talk about today is, in the era of all this potential inequity and decreased access, a product that can be used for self-care at home is very, very valuable.
I really appreciate the point you made, Dr. Fishkind, about inequities, and we're really talking about social drivers of health. You know, we're the barriers to access and success, and that are built into our traditional healthcare system, and these drivers can really push as much as 80% of health outcomes. So, you know, all other things being equal, no matter what the care is, we still have these outcomes that are driven by these external factors. And of course, these drivers disproportionately affect people of color, Black, Latinx, and Indigenous people, especially, as you mentioned. And this is critical because, you know, reducing these disparities is essential for reaching our health equity goals across the country. And we're talking about, you know, the very basics of healthcare access. The factors that feed that, whether that's transportation, proximity to a specialist or a primary care provider. Some of these things have been exacerbated by the pandemic as well. You mentioned trouble with technology. We do know that, you know, many of those that are impacted by these social drivers do have access, oftentimes at higher rates, to smartphones, et cetera. But these underlying capabilities, how new is it? Is it the latest version? Is the screen cracked? And can you replace it? All of those things also contribute to inequities in access. Of course, digital therapeutics can't overcome all of these barriers, but we can, by having self-contained models, really reduce these disparities in how people can access these particular kinds of care.
Awesome. Thanks, Miranda. I think, and Drs. Fishkind and Cuyler, I might have you tag team this one. In general, what do your psychiatry peers understand about the role of digital therapeutics in the care they deliver? Any reactions to what Miranda has here, and what's yet to be understood?
I'll just tell you a little story. In the last 2 years, I've given 2 presentations to the American Psychiatric Association virtual meetings, and they included talking about digital therapeutics. And after each meeting, I got hundreds and hundreds and hundreds of emails saying, wait a minute, there's digital therapeutics? What are prescription digital therapeutics? So that's probably representative of the fact that most psychiatrists I talk to have no idea what I'm talking about when I mention any of these products. They're not really thinking, most psychiatrists in the office are not really thinking about out of sight treatment. So you come in the office, you get your service, you leave. The rest of it is all sort of imaginary. So they're not really thinking about these digital therapeutics as complementary at this point. The other thing that's going on in psychiatry is that we're trying to expand the idea that there are 4 domains of treatment. There is the biological, psychological, social, and wellness domains, and now the digital domain. And so we're getting people more comfortable with the fact that we're using hardware and software instead of medication. And then the other thing we're trying to convey to psychiatry is that, you know, digital technologies help you with the triple aim: right place, right time, right price, add to overall population health, and improve the actual patient experience. So I'm going to look at something here with you. Bob and I are going to share talking about this. So,
Yeah.
you know, I'm going to let Bob start with a bit about psychotherapy. I'm going to talk a little about medications, then we'll talk about the advantages of digital therapeutics.
Really, to Solome, to tag on to your last question, there is really an access issue that is really kind of cemented by the prevailing ways that we were trained to deliver care, which is one patient after another comes into our office, we treat them, they leave, we see another. That's the way historically we've been paid. So the fee-for-service model has really tended to perpetuate the delivery model for how we deliver services. And unfortunately, one of the byproducts to that is access. So us psychologists are highly concentrated in urban areas. When you look at who comes to get psychotherapy, I was looking at a paper not long ago, and the prototypical consumer of psychotherapy in this country is a Caucasian with 4 years of college, which means we leave an awful lot of people out. And when we look at these access issues, in addition, we know that psychotherapy services tend to take a while. 4 to 6 months is really kind of typical. Some people get their needs met much sooner than that. As much as we've worked on our field, there's certainly some limitations. Not everybody gets better who comes to psychotherapy. And there's also really kind of a hurdle for people who were not culturally or personally inclined to talk about themselves, to talk about things that are really highly personal. Another real challenge when we talk a little bit later about panic disorder and PTSD is that the best research therapies involve really kind of re-exposing people to traumatizing situations. And a lot of people don't want to go there. They do not want to have to revisit reminders of their trauma. So consequently, there are a lot of people who don't engage in therapy because of that. And unfortunately, a lot of people who engage but then drop out because it's really not a comfortable or a tolerable way to work on their problems. For medications, I'll turn to Dr. Fishkind for his perspective.
Well, I think everybody knows that the general concerns about medications in the public. I have the same concerns when I'm asked to take a particular medication. Primarily side effects are antidepressants, our antipsychotic medications, our mood stabilizers, and our use of benzodiazepines all have a wide range of side effects. One of the most important being the use of benzodiazepines for various different forms and presentations of anxiety. Obviously, they can be addictive. Usually when I talk about those medications with people, they recognize the names and immediately ask me if it's safe to be on that medication. So first a major problem is side effects. Second is we have a huge discontinuation rate. 50% of our patients discontinue their medications. Where I work for this community mental health center here in Houston, it's unusual patients come in and tell me they are taking their medication. And that's mostly due, again, to the side effects. There's an enormous relapse rate. We see people up to 60-65% relapse rates for people out to 2 and 3 years of their major psychiatric diagnosis. Most patients don't want to be on medications for that long a time. We also have the problem of medications taking 4, 6, 8 weeks. It's all hit or miss, trial and error. We can't tell you how soon your medications are going to be effective or how long it will take. Telling somebody you'll be better in 3 months is pardon my expression, a tough pill to swallow to wait that long.
When we kind of look at how digital therapeutics play kind of an emerging role in the delivery of care, there are a couple of things. One is, for all practical purposes, they are almost side effect free. When you're interacting with technology instead of ingesting a medication, the risk of side effect is almost inconsequential. And also, as we've mentioned before, access, so that you've got the ability to engage with that digital therapeutic on your own time at your convenience. The ability to use treatments at home also bolsters privacy. For some people, even just the notion of walking into a mental health professional's office, there's concern about who may see them enter or exit. I think there is also something that is empowering and less stigmatizing about learning new skills by engaging in digital therapeutics that really kind of tend to have this information gathering, skill building, and personalization built into it. And as we begin to talk about the intervention, that I'm involved with, we really offer kind of a hybrid in which there is both human interaction from a coaching standpoint as well as the client's interaction with the digital therapeutic itself, so that coaching can support, education and adherence, deal with problems so that we, are able to kind of keep people engaged in a more effective kind of way.
Excellent. These are all great benefits. Anything you can say about kind of what's yet to be understood moving forward?
There are a lot of unknowns. I think for most practicing clinicians, how digital technologies will integrate with their other technology, mostly electronic medical records and that sort of thing. Also, I think a lot of people are not used to looking at real-time information and remote monitoring of data. It's not something that we've typically been trained or do very often. There's We need to help clinicians differentiate between apps on the app store that you're recommending that may not have any evidence that they actually work or potentially might in some way be harmful versus asking people to participate with a digital technology that's FDA approved, where we know the effectiveness, we know what side effects we can take, how long it will take. So I think, those along with the idea that people have to start thinking about a new form of research. We're not talking about researching medications and the standard way we might read research articles about that. We have to learn a whole new way to understand, read papers and data about digital technologies.
I think another part that's really yet to be understood are how these new treatments are going to be paid for. As Dr. Fishkind said, there are some that are 99-cent downloads on the App Store that maybe tremendous wellness projects products in some way, but are really not really vetted as robust individualized treatments. So there's a lot of work. When we talked about telehealth adoption in about 3 weeks' time, back about a year ago, all of a sudden the landscape changed. Actually, 2 years ago, where all of a sudden payment mechanisms changed. Digital therapeutics are not quite there yet. So the ways that treatments are going to be vetted and paid for are really critical. And actually, with that, I'm going to morph into my next slide, which really kind of talks about standards from the payer community for looking at evaluating digital therapeutics. One, regulatory approvals. Has an intervention been vetted by the FDA, which really requires both safety data as well as effectiveness data? And then, of course, what scientific evidence is out there? What kind of clinical trials, what kind of peer-reviewed publications support that these are treatments that can be effective? And that effectiveness is really documented by multiple studies showing that health outcomes actually change on the basis of the intervention. Another important is with these efficient technologies, do they have an opportunity to reduce costs? We know that the health and psychological consequences, medical and psychological spending for people with mental health conditions is really significant. And so there's a lot of focus on whether early intervention with digital therapeutics can actually reduce medical utilization and costs. And then finally, does this work outside of the laboratory? It's one thing to have a published clinical trial that's carefully controlled. Do these interventions actually work? Are they adopted? Are people actually using them and sticking with them? And are they benefiting? So those are really the kind of criteria that are looked at. When we go forward, we're going to talk a little bit now about what Freespira is and why it is and what it does. So Freespira is a digital therapeutic that's cleared by the FDA for treatment of panic and PTSD. And it's quite an interesting device. I think just about everybody has heard that meditative breathing is supposed to be good for you. Well, when you really look at these conditions that we treat, there's a kind of respiratory dysregulation. It's subtle, but people breathe routinely and particularly when they're stressed in a way that seems to aggravate and cause these kind of symptom surges that we see in panic and PTSD. And the Freespira system was developed to help people normalize their breathing. We measure respiratory rate and exhaled CO2 levels. The specifics of that, I think, is more than we can get into in this brief presentation, but both components seem to be really critical for teaching people how to normalize their breathing in a way that helps them. So this is a system that's used at home twice a day for 28 days. The patient basically sees a readout of their respiratory style, and the system guides them to pace their breathing and to change their respiratory volume and normalize their respiratory physiology. That all sounds kind of arcane. Like a lot of treatments, we don't completely know why it works, but we do know that people who will use this regularly for a month, about 80% will have really significant reductions in their symptoms. Another aspect when we talk about digital technologies are all of the data that's generated during the patient session is uploaded to a secure server so that the patient, the health coach, and the company can look either at an individual level or at an overall level at whether people are actually using it, whether they're hitting their respiratory targets, and whether they're getting better. So we've got the system itself, we've got health coaching, and we've got data analytics, all of which support effective treatment, but also data transparency and really the ability to substantiate that people are using and benefiting from the treatment. When we
really excellent. Thanks, Dr.
Let's
Cuyler.
see,
I was just going to say,
I think we have moved to okay. So one of the things that we emphasize with digital therapeutics, I think we've already touched on, is at-home accessibility, privacy, overcoming some of the geographical and access barriers, and individualization, measurement of outcomes, and other really critical aspects of the delivery system. So in this example, I've really already touched on the aspects that we look at in terms of how to measure essentially the viability of a digital therapeutic. And with that, I'm going to talk a little bit about what the published outcomes look like. There have been multiple published independent studies that have been done. When we look at this on the left-hand side, we see treatment of patients with panic disorder who began this treatment with really a severe symptom load. And what this slide shows is in the middle, those three bar graphs show a really significant reduction of symptoms within 28 days and maintenance of that symptomatic benefit out to a full year. That's what really caught my attention when I was introduced to this intervention, that it worked rapidly and that people who got better were staying better a full year later. An additional study not only looked at the clinical benefit, but it looked at reduction in medical spending. One thing we know about panic in particular is because the symptoms are so physiological, people have symptoms like chest pain, shortness of breath, dizziness, tremulousness. They go to their doctor a lot. They go to the emergency room. They go to cardiologists. They go to neurologists. And what happens in this particular study is documenting that as people get better, they stop going to the doctor for these symptoms that are really rooted not in a diseased heart, but in the physiology and psychology of panic attacks. So we see this resolution, we see this really significant overall reduction in health spending, but we see a drastic reduction in emergency room costs and in pharmacy costs as people are getting better in the year post-treatment. There was also a trial that was looking at treatment of individuals, both veterans and civilians, with post-traumatic stress disorder. This is a really, really challenging population. Both of these are very common conditions. About 10 or 11% of the US population has one or the other of these conditions. We know that PTSD is both a significant civilian and military problem. This particular study measured reductions in PTSD symptoms done at the Palo Alto VA. And as we can see here, well over 80% of people had clinically significant reductions. I'll mention here that the average person who enrolled in this study had a 19-year duration of PTSD. So these were people with chronic conditions. And a full 50% of these no longer had PTSD, no longer qualified for this diagnosis 6 months post-treatment. This 77% adherence number is, again, indicative of a treatment that people are using at home, but using as directed. So we see something about the tolerability of these at-home interventions that sometimes is strikingly better than the challenges we talked about with medication adherence and therapy adherence.
Awesome. Thanks so much, Dr. Cuyler. Excellent data. Miranda, I'd love to pivot to you real quick. Based on everything we've seen here, just given your experience, what role do you see digital therapeutics in terms of addressing access and equity?
I appreciate that question. Thank you. Digital therapeutics can really transcend some of the traditional barriers that we've talked about here, including, of course, geographic hurdles. We have an opportunity to introduce these technologies into people's homes, and also address indirectly the discomfort that folks may have with those traditional sites of care. Entering a space where mental health care is delivered could be a significant barrier for folks. And then also difficulty making or keeping a doctor's appointment, depending on how your work schedule or life schedule works. And there's also, of course, stigma associated with mental health conditions. Specifically, at Freespira, we work on panic attacks and anxiety disorders. There's often a deep discomfort in having those conditions with leaving the house. And so a therapy that can be effectively delivered at home can be a huge differentiator for patients. And that's in addition to those who just plain have a difficult time surmounting their geographic hurdles. If you live in a rural area and the closest specialist is 50 to 100 miles away, or in a metropolitan area, that kind of exacerbates your triggers. We're also talking about culture fit. We often talk about that in the context of people of color, but culture is dramatically different across the country. And how people engage with healthcare can be influenced significantly by that. So offering this sort of privacy can be really, really valuable. And then also, of course, ease of use. In the case of behavioral disorders, patients may already face trouble concentrating, have some anxiety, fear of failure, or other debilitating aspects of their conditions that make compliance challenging, that make engaging with healthcare providers difficult or impossible. And these treatments, a lot of treatments don't work if the protocol isn't followed. So we need to simplify these sorts of access and how they're delivered and supported. And digital therapeutics like ours really do help to do that. We also empower patients. And I think that's a really important word in this context, that self-directed, professionally supported care, that 1-2 of you control your care, you can have it in your own space, but we have support in the form of coaches that can meet with you digitally over Zoom, can call and text you, can receive your calls and texts to support you throughout your care in ways that are less formal and less risky from a scheduling and access perspective than some of the traditional appointment making. And then also potentially lower costs, high rates of adherence, and proven outcomes should all contribute to the confidence of our patients as they move through these kinds of care across the spectrum. And then also thinking of Freespira specifically, the kind of retraining that Bob was mentioning earlier can really feel like people are walking away with something that they won't have to be dependent upon in the long term.
Excellent. Now, if I could ask you a little bit about, from the patient perspective, Miranda, in your experience, what resonates with patients when it comes to digital therapeutic treatment options, and what is it that they value?
I think people really appreciate the opportunity to either opt out of therapy or medication, or to have an opportunity for complementary care. These things are not mutually exclusive. There's no reason that you can't take advantage of a digital therapeutic that's clinically proven to address the issues that you're having hand in hand with your talk therapy or your medication. This just addresses something else. And then the ability to do it at home. Again, thinking about culture fit, cultural appropriateness, access, scheduling, transportation, all of these things that might be very serious barriers to accessing care in this traditional model are all very valuable in the context of digital therapeutics. And we've also talked about access from a digital perspective. Providing the tools themselves, not just assuming that you have everything that you need and can just turn on your computer, that you have the fanciest and latest smartphone. That there's another component that you can walk through and support, and with being supported by a professional, a clinician that gets where you are and can contact you at home in your own space, taking advantage of the comfort that you've built around yourself.
Excellent. And Dr. Fishkind, if I can turn it back over to you, just based on what you've heard all of Miranda say just now in terms of benefits and health equity and access, as a practicing psychiatrist, what do you see as the benefits of digital therapeutics like behavioral health, or like Freespira and behavioral health? And really more specifically, how do you view digital therapeutics fitting in the overall current behavioral health landscape and offerings?
So back in 2007, when we started doing emergency telepsychiatry, I can tell you it was kind of a giddy experience. All of a sudden, psychiatrists who people complained all the time were never available. You could never see them. You had to wait interminably for appointments. There we were, whenever you wanted us, on demand and right there in any location, on the streets, with iPads in emergency departments, in clinics, and local, health. I mean, just anywhere you could imagine. And there's a giddy feeling, a real positive feeling about learning how to use these digital technologies to enhance your capability to treat people anywhere, anytime. It's kind of a thrilling thing. And the more we kind of celebrate the fact that we have these digital therapeutics, the better for healthcare and the better our outcomes. So we talked about, extending the reach. So many different clinicians can extend their reach using these technologies, not only hard to reach populations, but also, as was mentioned, using it adjunctively. So therapists who are doing therapy can use it adjunctively. Psychiatrists using medications can use it adjunctively. That is an enormous advantage in our profession. Also, I think, in behavioral health, we really don't necessarily feel we get consistent results. Sometimes our effectiveness is not that far off from placebo, even if it's statistically significant. So having consistent results, an equitable experience for people that they can access, very low side effect profile, and also the ability to potentially achieve far better outcomes by quickly and efficiently using different domains of treatment is very exciting. And of course, all of this hinges on bringing clinicians and payers together. You have to understand what are the advantages, both the clinician and payers. We're going to keep spreading that information. I'd like to say that well-trained is well-armed. So once we have and understand how these digital therapeutics enhance what we do, I think payers and clinicians will better see how they can achieve even better clinical outcomes than functioning in their only in one domain.
Fabulous. Thank you all. Super exciting to hear about the great work happening at Freespira, but one of the more exciting things that I'm looking forward to showcasing in this webinar is having the opportunity to hear directly from a patient who has undergone treatment with Freespira, in fact. So, I mean, after all, the most important goal is getting the right kind of treatments to patients so that they can benefit. So without further ado, I'm going to go ahead and play our video.
Prior to using Freespira, I suffered from panic attacks relating to PTSD, generalized anxiety, headaches, and mood disturbances too. I was seeing a EMDR therapist, and he had put me in touch with a psychiatrist who put me on like a low dose of Prozac, and almost immediately I felt almost worse, and I really wasn't a fan of being on medication either, so I was thinking there had to be a different way. So I noticed with the Freespira right away that I was calm, I was able to focus. It was almost like taking a prescription because I knew exactly what I had to do. You know, I knew that I could take my medication every day, but it was different in that the effects were immediate and then it was also lasting.
Awesome. Powerful words and a great example of the real world impact that digital therapeutic treatments in behavioral health can make. Thank you to our panelists for sharing your insights and experience regarding the role of digital therapeutics in behavioral health in general, and especially in regards to access and equity in particular. This is something deeply personal for me, you know, as somebody who's a first generation American and dealing with the various cultural sensitivity issues, in addition to struggling with panic attacks and anxiety as a teenager myself. And so really thrilled to see this great work and looking forward to having Freespira get into the hands of all those who need it. So now we'll go ahead and open up the session for questions. Let's see, we've got a few already rolling in. Why don't we start with, so I use meditation apps. How is Freespira different or better than just specific breathing techniques or meditation? Panelists,
Okay.
maybe Dr. Cuyler?
Yeah, so I'll take that one. So I'm a huge advocate of breathing techniques and meditation. And so for the general stressed out population, they are wonderful tools. There's some things that are really characteristic to the physiology and we think genetics of people who end up at risk for panic disorder and PTSD that really calls for an additional aspect to just teaching paced breathing. So it's that monitoring and feedback of CO2 levels that seems to be critical. I'll just mention there was a fascinating study. There's a really cool breathing app that came out of the UK. They offered it to people who had panic disorder, and it had zero impact. It had no effective impact on panic symptoms or on hyperventilative breathing. And Freespira, by comparison, during the same time frame, has this really robust symptom reduction associated with it. So for people who are at risk, we think this is an individualized treatment that has a really important component that general breathing apps, as good as those are for the general population, are just really not dialed in for people with these specific serious conditions.
Super helpful. Let's see, next, and other panelists, please feel free to weigh in. How about, how often do patients do the treatment more than once? Or how, I guess, what's the frequency
I'll
of
take
treatment?
that one. Really, not very often. One is that in 28 days, people are practicing, basically a half hour or more a day for 28 days. So they are really learning skills that they carry with them. For people who begin to feel like there's a bit of backsliding, we provide an app for alums that emphasizes just maintenance of the paced breathing. But I kind of make an analogy to the training wheels on the bicycle. After you've used the training wheels for a month, the training wheels can come off and you've got those skills. Because I review all of our patient care, what I hear over and over from patients is that they are developing skills that they are able to use when they're feeling stressed or triggered. And it seems to keep the symptoms from surging like they have before. So really pretty rare that we see people in need of a retreatment after their first treatment episode.
Great. Okay, next we've got, what's the profile of patients who try Freespira? Maybe Miranda, if you want to go.
we have a wide variety of patients that are able to engage with us through Freespira, and really we're talking about those who benefit from the reduction of barriers that we are able to provide, the convenience of being able to ship a device and all the components directly to a patient, the flexibility of being able to use it adjunctively with other forms of care. It's easy to do at home. And it's a relatively short treatment. In 28 days, often less, people can see a significant impact on their day-to-day lives. And then, of course, we have telehealth coaching support. And so you're really not alone in this. And so for folks for whom any of those components are really appealing, being able to be at home, having all the components right there in front of you, using it on your own schedule, and having that support, and really in a remarkably short amount of time, those are really appealing to a wide variety of people, regardless of where they are in their healthcare journey otherwise.
Awesome. Okay, let's see. We've got our next question is around broadband. Okay, how does lack of broadband affect digital therapeutics reach? Are there certain parts of the country where broadband access has created challenges for Freespira?
I'll just talk about that briefly. We have seen not so much geographic, because broadband is so much more available now. We really almost see it individual by individual who may only have a smartphone, may not have good internet access in their home. So that's really kind of the challenge. The treatment, the Freespira treatment itself, is really kind of standalone. Patients can do it without being connected to broadband. Our health coaches can use a phone or a smartphone or even text sometimes to communicate and support their patients. It's not perfect, but we have certainly made some headway in kind of finding creative ways to work around that digital divide.
Fabulous. Next, we got, let's see, Julia. How do you think precision medicine is going to change or improve medication management and efficacy?
If that question is related to medication, precision medicine is an emerging idea. That's the idea that everybody is variable in their genes, in their environment, in how they live their life, their lifestyle. If you think about most treatments that we have right now, it's sort of a one-size-fits-all approach. And where we're trying to branch out in the profession is to hone in on how this variability in genes and environment and lifestyle determines how we use different types of treatment so that it's targeted specifically to the person. We're just starting to make progress in this realm. Some people are doing some really fascinating work where they look at studies of the brain and how different parts of the brain function differently, what parts of the brain are not functioning properly, what parts of the brain use inhibition and disinhibition to control what happens to somebody. I think we're gradually going to move to a place where we make much more informed decisions, and we can order tests and do things that help us better understand a person's genetics. So I think we're going to make progress in medication. I think that was the question in better targeting and focusing, but I think our digital therapeutics will go through the exact same process where we get better and better at determining which digital therapeutic treats people with their specific variability in genes or environment. It's an exciting thing. I mean, it's going to dramatically change the medical profession as we go forward.
Great. Let's see, Kimberly, have you used this in children or teens at all?
Yeah, great question. One of the other things that happened with the pandemic is the FDA gave latitude to companies that offer digital therapeutics that really have evidence base, but also strong safety data. So we've been able to offer Freespira to adolescents ages 13 and above. What we've found is that the actual clinical outcomes and adherence are almost identical to what we're seeing with adults, that the kids seem to be, engaging effectively in the treatment and getting better, really at the same rates as we see in our general adult population. This is also important because there's tremendous shortage of child psychiatrists and psychologists, so access is an issue there. And we know there's really understandable reluctance about starting kids on powerful psychoactive medications, during their developmental years.
We're also able to engage parents effectively in that treatment as well. Going back to having this treatment take place at home, as in the context of our treatment of teens, 13 and up, we are able, our coaching support is able to also help parents navigate what that care looks like and how to support their children through it.
Fabulous. Let's see. Dana asks, for patients already on medications, is it recommended to stay on the meds through using the app? Dr. Fishkind and Dr. Cuyler?
So it's a challenging question because in many circumstances, patients can actually use this product before they even have to start medication. I want to make sure that the reverse sort of perspective is also there. So the question might also get asked, if I'm already on the app, should I start medications? Usually when we start medications, they're for particular symptoms that are affecting daily functioning and have to be dealt with right now. Those medications are often taken for a period of time, 3 to 6 weeks, I would say, where you have to deal with the more acute symptoms first. I don't think we have concurrent data, but if a person is getting effectiveness from the medication, I would say that they can be done concurrently.
I'll add to that, what we often see, particularly with benzodiazepines, are patients who are wishing to reduce their use and dependence on benzodiazepines for managing their anxiety, that many of them are reducing their frequency and dosing and finding that they're able to manage their anxiety. So it's not been systematically studied. From the research projects, people who were taking medication continued taking medication during the treatment course, and so there's no complication, there's no clash between taking medication and using the treatment. We certainly see anecdotally, and I hope we'll have research at some point in the future about the utility of, for example, reducing medication while doing this intervention, so that people are able to maintain basically their symptom control, but also to build self-management skills and are less reliant on medications as they go.
Excellent. Okay, let's see. I think we have time for just a couple more here. Alexandra asks, the treatment compliant numbers from the VA study were encouraging. Could you speak to the specific modalities and other VA support services that the study population received as a complement to the digital therapeutic that may have helped with compliance and outcomes?
Yeah, well, it's interesting in that study, the patients could not be currently in psychotherapy. And if they were on medication, the patient and doctor agreed that they would hold their medication dosages stable. So the only support that they got during this was participation in the study itself, which is really important. But they got really the same health coaching as is really done in ordinary practice. So there were no additional support services. And the adherence that we saw in the VA study is really very, very similar to what we've seen in the other studies and in our general use. And we think it's a combination of that health coaching, the lack of side effects, and people experiencing benefit within the first week or so of their starting care.
Mm-hmm. Fabulous. Okay, and I think we've got time for one more question here. Let's see, Amin. Which payers cover this app?
At this point, Freespira is covered by Highmark Health. It is a covered benefit in the Northeast for people who are Highmark beneficiaries. We are also covered by Children's Community Health Plan. when we talked a little bit about health access, this is a predominantly a Medicaid population, and so we are seeing, really comparable recovery rates for people with this Medicaid population, where we know the burdens of social determinants of health are much more significant than our general population. We are working very closely with a lot of other payers to have them adopt coverage.
Fabulous. Well, and I know we've got a few more questions rolling in last minute here, but if we didn't get a chance, please continue to type them in there, and we'll make sure for somebody from the Freespira team will address them. But as always, having the great pleasure of meeting you, advance of the call. I just wish we had like 6 more hours. Thank you, Drs. Cuyler, Fishkind, Miranda. Thanks so much for taking the time, and really enjoyed this discussion. And thank you all attendees for joining us today.
Thank you for that great presentation and for sharing your thoughts. And thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again, and enjoy the rest of the day.